This is One-on-One. Hi, I'm Steve Aduabto. I'm joined by Dr. John Matsinger, who is the Vice President, System Chief Medical Officer at Virtua. Doctor, we are here at the CHOP at Virtua Pediatric Diagnostic Imaging Center. Long name, big significance. What exactly does it signify?
Really, it signifies changing how we deliver care to our community. Previously, you really had to travel to Philadelphia to receive this level of care, especially on the diagnostic imaging side for children. This center allows us to provide that care to people in our own community without having to make them travel. We use all the expertise that CHOP has developed over the years.
By the way, you keep talking about CHOP. We should make it clear that CHOP
Children's
is
Hospital of Philadelphia.
pretty well known.
Pretty well known.
Good
right?
partner.
A great partner, and they've been a great partner to Virtua over the last couple of years, and we've really have been able to transition and really raise the bar on how we deliver care.
It's interesting. You talk about delivering care where people are, as opposed to what?
As opposed to having to travel, whether that be to Philadelphia, New York City, or somewhere else, a further destination, with that traveling comes a lot of expense, a lot of time, and a lot of stress. And this really lowers that for the family and for the children.
One of the pieces that's interesting as I was getting ready for the interview, one of the areas in pediatric diagnostic imaging, by the way, describe what that is, and then I want to talk about pediatric sedation, which is a part of that larger equation. Pediatric diagnostic imaging is?
Radiologic services provided to children. So in this case, we have the Children's Hospital of Philadelphia's radiologists actually reading all the images for CAT scans, MRIs, X-rays in this center, ultrasounds. So these are really world-class experts, fully trained in pediatric imaging.
Okay. Now, the sedation piece of it, what is it and why could that potentially be really important?
Okay, that really differentiates this unit to a whole nother level. And this was only really provided at CHOP downtown and I believe one of their satellite facilities in Pennsylvania. And what changes everything is the people we have working here. We have children life specialists, which are experts in child development, as well as pediatric sedation specialists, and our nursing staff are all focused around the child and the family. And what these people do is really work the family and the children through the procedure. So our child life specialists will work to lower stress on the child and the family. If sedation is necessary, we have our sedation specialists, and really with the goal of, when sedation is necessary, providing it safely and less is best.
What goes on for these kids?
Well, what goes on for the kids is, this is scary. I mean, this isn't the playground. Look at it, there's a lot of lights, there's people moving around, there's alarms. It's really trying to get them comfortable and at the best you can, understanding the test they're gonna get. Try to relieve the fear. But maybe even a little more scarier is for the parent. It's the unknown of what your child's going through, and that's really what differentiates this unit, is the work of the entire family. I mean, I'm a father of 2 girls, and I'd rather go for any procedure on myself than have them go through any procedure. So it's really trying to get that touch and that humanity around it, and really.
So hold on, it's not just the clinical side, is what you're saying?
No, not at all. It's really around the whole person.
Talk to us about, it's interesting, as we were doing the research for the segment, you begin to realize that there are, this particular approach, this model for doing this, it's not all over the place, right?
No.
You're getting folks from?
We're getting folks obviously from the southern New Jersey market, but we're starting to see people from central New Jersey, northern New Jersey come down. And because CHOP has been so successful in their own community in Pennsylvania, there's obviously always a wait time. So we are starting to see some of those people who need the testing a little bit quicker, but we are starting to see a bigger pull and a bigger community drive to get the imaging done.
When it comes to this whole question of, this be well, get well, stay well that you talk about a lot, it's a slogan. What does it actually mean particularly when you're dealing with kids?
Well, you're right, it's a slogan. For us, it's not a slogan, it's our mission. And our mission is to be well, keep the community whole, keep them moving forward, keep everybody on the right path to health. Get well. We are an aging community in general. We're a community with a lot of comorbidities, obesity, diabetes. It's really changing how people think, how people eat, how people exercise, how people act, changing how they live their life. And then stay well. Once you get them there, keep them there. Or if they're there, prevent them from going down the wrong path. And really, this entire building and our other health and wellness centers are built around health and wellness. As an organization, we've been hospital focused, but we're transitioning away from that. We're more community focused, outpatient focused, and getting our community healthy.
Yeah, it's so interesting. You say we're hospital focused, and then you say we want to move away from that, as if that's a bad thing.
Well, I think the hospital is a good thing when you're sick and you have to be treated, but overall, we want to prevent you from ever being in the hospital. We'll never put ourselves out of business. Somebody's always going to need hospital care, but some people are in the hospital every single month for chronic conditions. That's inappropriate. That's not good care. We need to do a better job on the outpatient side.
But doctor, isn't it also fair to say that the government, that the laws, that healthcare reform, that January 2014, the implementation of what many call Obamacare, the Accountable Care Act, is saying that's what you have to do?
They're starting to put the focus on quality and prevention.
And not coming back to the hospital.
Not coming back to the hospital. I have to be honest, we looked at this 3-5 years ago, and we really saw that that's where healthcare should be. And that's why we made a huge investment in primary care physicians, really bolstering that market. We saw in southern New Jersey primary care physicians exiting. The reimbursements were bad, the hours were long, and it just wasn't worth it to them. And we knew that we had to focus there, because without our primary care physicians, who will take care of these patients? Looking at our nurse practitioners, our physician assistants, and really building a medical community.
Well, it is a challenge every day, and everyone focuses on January in 2014 as if, a switch gets turned and all of a sudden, hey, that's when the national healthcare reform kicks in. But as you said, clinicians and hospitals all across the state, all across this nation are working on it every day. So I want to thank you, Doctor, for sharing what's going on here. We appreciate it. Thanks for joining us. Stay with us. We'll be right back after this.
One-on-One with Steve Aduabto has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Aduabto has been provided by Investors Bank, the Russell Berry Foundation, Fedway Associates, Inc., New Jersey State Nurses Association, PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Aduabto has been produced in partnership with St. Joseph's Healthcare System.